There's growing pressure on the 4 home nations of the United Kingdom to make changes to the COVID rules agreed for the Christmas period. Further talks will take place tomorrow, amid concerns that the guidelines as they stand will lead to a very significant rise in cases. 2 leading medical journals have joined forces to warn that easing the rules for a 5-day period over Christmas is rash and will cost many lives. Labour has called today for the guidelines to be much clearer and tougher. We start tonight with this report by our health editor, Hugh Pym.
Christmas mixing will be a big mistake. That's the bleak message from 2 publications representing health and medical leaders. If the rules agreed by the UK's administrations which allow some household mixing aren't changed, they argue that virus cases will escalate and the NHS will be overrun.
The real striking, stark truth of the matter is that our health system is not going to manage if we allow the current trend to continue out on top of the super spread event that will be these 5 days of Christmas with households, 3 or more households meeting. People will find it hard to stick to those rules.
But ministers were sticking to the line that people should make their own decisions within the rules set out.
We've got to trust the British people to act responsibly, to do the minimum that is necessary for them within their family situation. But we should recognise it has been a very difficult year for many families. Many families will want to come together.
But the government at Westminster's facing calls to look again at the planned easing of restrictions over Christmas.
I say to everybody, look at the evidence as it is. The last 2 or 3 days have seen a spike in infections going up, notwithstanding the tiered system. We can't stand back and ignore that. This needs to be reviewed, needs to be done pretty urgently now.
And Scotland's First Minister suggested there might need to be a rethink.
It's important that we have that discussion across the 4 nations, given family patterns across the UK. But I do think there is a case for us looking at whether we tighten the flexibilities that were given any further, both in terms of duration and numbers of people meeting.
The politicians will have to gauge public opinion.
Spending time together was not going to be the best thing.
Joe has already cancelled a Christmas trip to see his sister.
I think people just have to be sensible this year and really think deeply about what really matters to them.
But others have made plans they say will be hard to change.
The turkey's on order. £15 turkey. If there's only Jill and I for Christmas dinner, that's a hell of a lot of turkey to eat, you know.
So you're happy to have your injection today?
Yes.
Vaccination centres are now up and running, including this one at Barnet Football Club, where they're hoping to get through 350 jabs each day, starting with the over 80s and the first appointments today. Vaccination centres like this may have got underway, but it'll take at least 4 weeks and 2 jabs to build up protection, and the process of getting through the most vulnerable patients will take time. And doctors in this North London area are very concerned about the rising case numbers they're seeing now.
It is a phenomenal threat. It is very, very worrying. The number of cases, results that we're coming in with patients being COVID positive and actually unwell, especially at this time of year when we had the easing of the lockdown, people are mixing with each other, mixing with families. It's rising.
Some European countries are tightening up in response to higher infections, but allowing a little leeway over Christmas. The UK's governments will continue talks tomorrow on how to strike the balance. Hugh Pym, BBC News.
Let's go live to Westminster and talk to our political correspondent there, Chris Mason. Chris, as we know, the talks to take place tomorrow. Are you detecting any signs there that there could be change to these Christmas rules?
I think there's going to be a change, Hugh, in tone, but perhaps not a change in the law. It's been the central dilemma for political leaders here in the UK and indeed around the world throughout this pandemic to manage that balance between robbing us of the liberties that we take for granted and protecting us from the virus. And what to do over Christmas is the ultimate example of that. Political leaders are really conscious that they don't want to rob us of that precious chance to see loved ones, that would be a cruel end to a cruel year. And yet, we heard there the warning from the medics that, frankly, this relaxation could cost lives. So what on earth do the governments around the UK do? They met earlier this evening. There seems to be an agreement that they will shift the tone, the messaging that we will hear from them. So they will say that the rules are a limit, they're not a target. If you're going to see vulnerable people over Christmas, elderly people or those who are clinically vulnerable, change your behaviour now, restrict how many people you're meeting. If you live in an area with a lot of the virus about, think carefully carefully about leaving that area. Stay local if you can. So that will be the emphasis in the coming days. The new approach isn't yet signed off. There'll be another meeting tomorrow involving the government here and the governments around the UK, but expect that to be what we hear from the Prime Minister in the coming days and from the devolved leaders as well.
Chris, once again, many thanks. Chris Mason there, our correspondent at Westminster. Well, now, under the Christmas rules as they currently stand, agreed by the 4 home nations, families will be able to travel across the UK and 3 households will be allowed to gather under one roof. But as we've heard, many experts believe that these guidelines will provide the perfect conditions for a significant rise in cases. Our science editor David Shukman examines why.
It's a precious time of year for restoring morale, and scientists researching the virus recognise that. But they also know that spending long hours in packed rooms is the most effective way to spread it. On the one hand, schools will be closed over the Christmas break, along with most workplaces, and that should help to reduce infections. But on the other hand, having more people gather indoors is bound to increase transmission. This animation, by an industrial modelling company, simulates someone infected. Researchers are worried.
I think there's a big risk over Christmas of essentially a transfer of infection from younger groups with more contacts into older age groups who might not usually have this level of mixing, especially in this kind of year. And even in normal years, we do see an increase in hospitalizations for things like pneumonia after the Christmas period.
The rule across the UK is that 3 different households can form what's called a bubble over the Christmas period and shouldn't be mixing with people outside it. Now, scientists say that it's within homes that the virus spreads most easily because people are so close together. On average, someone infected may pass the virus to 3 others. So the more people in a bubble, the greater that risk. And another worry is after Christmas, when people who are newly infected return home to other parts of the country and start mixing with friends and family there. After the American holiday of Thanksgiving last month, with 4 million people travelling, health officials are watching for signs of a new surge in infections. British scientists say that their studies show keeping gatherings small will make a big difference.
It's easy to imagine a kind of terrible scenario, but actually when you start modelling it, you can then start thinking about how you would balance the increased risks somewhere else, and how if people who don't need to form a Christmas bubble decide not to, how that actually improves the overall situation.
And if you do get together, open the windows. This animation shows how fresh air helps to disperse the virus. No one can be sure of the impact of the Christmas break, but there are ways to reduce the risks. David Shukman, BBC News.